Hey all, it's John here. Well, I update for you. This was my second week of pre-op diet. Was supposed to be leaving for Mexico on Sunday, July 31st, and having my surgery down in Tijuana at the Obesity Control Center with Dr. Ortiz on Monday, August 1st. But I threw my back out last week. And I've gone to the chiropractor 5 times, got 2 massages, just wasn't happening, getting any better. So went to the doctor yesterday, and she would not clear me for traveling. I have to have an MRI done on Monday, and it's just excruciating pain, and there'd be no way that I can be in a car and drive for 6 hours or get on a plane. So unfortunately, I had to reschedule, and I thought it would be maybe 2 weeks, 3 weeks delay, but now it looks like my surgery is not going to be until September 12th, because that's the soonest that they could get me back in. So now I'm going to concentrate on getting my back better and continuing to get weight off and overall just be healthier. Part of me is a little relieved, and it was a big jam to get the weight off, which I did. I've lost 35 pounds. Actually, I think maybe even 37. So I already hit my goal weight that I needed for the surgery. Stats, my highest weight was 330. And then throughout this journey and the pre-op diets, I down to actually 293, I think. I've definitely hit the 295, but my scale's been kind of fluctuating with the pain pills and the non-exercising. It's just been really crazy. There was a day that it jumped up 7 pounds, and I didn't go off the diet or do anything, and then the next day it just went back down 4 pounds. So it's just been really strange. So my body's definitely reacting to the pain medication and the lack of exercise. But the good news is that I really think I'm about 293. So that's 37 pounds total since I started this journey about 7 weeks ago. So thrilled with that. Maybe even a little bit more relieved that, with my body reacting by not exercising with the medication and then being put on prednisone, which I understand is a steroid that's going to actually increases your appetite and can make you gain weight. So I'm a little nervous about that. So maybe a little relieved that I'm going to have 6 weeks now to get this resolved, get off that medication, and get the weight back off. Not that I hope to gain any, but just in case this medication does make me gain, 4 or 5 pounds or something. So I'm going to go back to the 6-week diet plan that I was on previously and just kind of stay on that. And, when I get to the 4 weeks out, I'll do the 4 week out one. And then when I get to the 2 weeks out again, I'll just start right back at that 2 week out thing. I have kind of given myself another goal that I'd like to get off 30 pounds between now and the next surgery. So I would like to be going into surgery at 260, 265. I don't know how realistic that is with the condition of my back and the medication and how things are going to go, but even if I can get 10 pounds off in this next 6 weeks or 15, that's still going to be 10 or 15 pounds less than what my goal weight was to have the surgery. So I'm just kind of taking that attitude. Okay, I'm just rambling. Again, thank you for all the support and comments, and that's my journey. So surgery now is not till September 12th, and today's just July 28th. So 6 weeks away. Here we go again. Don't know that I'm going to be necessarily doing weekly updates at this particular junction of the game. Maybe I will, to kind of keep everything posted and just keep my journal going along. So take care. Hope everyone's well.